Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're here at the Sequoia Project annual meeting, and our guest is McCollister. She's a patient advocate and involved with Sequoia. Welcome.
Thank you. It's a pleasure to be here.
Yeah, excited to hear about your story. I mean, you have a crazy information blocking story. I think people are going to really enjoy and hate, and I mean, it's a lot of emotions, I think, every direction. But before we get there, tell us a little bit about yourself.
Sure. So I come to this meeting really as a patient advocate. I work as an independent consultant focused on data use, governance, particularly within the context of trust and earning patient trust. For Sequoia, I am both a board member, a member of the board of directors, but I am also leading and co-chairing the consumer engagement work group, which is focused on bringing industry together with consumers to solve some of the issues related to consumer and patient data dysfunction.
Wow, I love that Sequoia Project has a patient and is listening to the consumer. That's so forward thinking of them. How would you describe the overall burden that patients experience? I wish I had the image that you just shared previously of all the medications and devices and treatments and everything that you deal with, but how would you describe kind of the burden that the patients are experiencing?
Well, it's pretty substantial, and it's the kind of thing that's it's easy to acknowledge that it's difficult and then forget how difficult it is. And when I've spoken a lot to corporate audiences over the years, one of the things that's been challenging is to try to get the people, the work of the various companies who are committed to doing the right thing, to really understand that 5-minute or 10-minute or 15-minute additional thing that they're asking patients to do to be able to access their data or their device or whatever it is they're asking them to do happens within a broader context of very difficult and complex activities that are required to manage your disease. So for instance, when I was first diagnosed with diabetes, I had no idea what that meant, but within short order, I realized that there were 5 core pillars of my treatment regimen: lifestyle, physicians, medications, labs, and medical devices.
Okay.
But fast forward a couple of decades after living with the disease, when you have developed the complications from diabetes, so I have eye disease, nerve disease, kidney disease, other comorbid factors. What exactly does that look like? From a lifestyle perspective, you have to eat right, manage your stress, meditate. I do strength training, cardio, yoga. Occasionally I like to have a social life. I take a lot of supplements, and that's like just the baseline. That's the stuff that everybody needs to do.
I was going to say, that sounds like a good list for me.
Right, exactly. Well, that's the thing, is everybody needs to be doing that stuff. But when you have diabetes, it's even more important to stay on top of it because things can go awry quickly. And then you move into physicians. And currently I have 16 different physicians. Wow. I see some of those a lot more frequently than I do others, but it takes a lot of coordination and of getting the information, making sure that each physician has what they need from the other appointments, making sure the lab values get there preferably ahead of time. But that's a lot to manage. Yeah. And I'm able to do it, but it's a lot. And then you get into medications. Currently, I take 21 different medications. Not all of those are every day. Some of those are weekly, some of those are monthly. But each of those requires me to stay on top of not only taking the medication, but making sure that I have enough refills, making sure I'm seeing the doctor in sufficient amount of time to be able to get more refills if it's a doctor that I don't see that frequently. Several of them require prior authorizations, and even though the physician is the only one that's empowered through the system to do the prior authorizations, the patient is the one who's ultimately responsible for managing and making sure that that happens. So getting the lab work, making sure the lab work comes in, getting it from the physician to the insurance company or the pharmacist, depending on the specifics of that prior authorization requirement, getting the information from the insurance company, communicating that to the pharmacist. All of that is on me to make sure it happens. And if I'm not actively engaged in that process, or somebody isn't actively engaged in that process, things fall through the cracks. And then you move into labs. Every 3 months, I get 117 different lab values taken. I focus on about 10 of those, which are critical for me to understand my chronic kidney disease. And then you get into medical devices. I currently use 11 different medical devices. I never leave my house without 5 of those on either on my handbag or on my body. 4 of them are attached to me 24/7.
Wow.
Only 2 of them connect in any kind of real, meaningful way, and that's my insulin pump and my continuous glucose monitor. And they only connect in a meaningful way because a patient hacker movement that my friends and I helped start several years ago, the We Are Not Waiting movement, the patients actually hacked into the system and connected them, so that I now run an open sourced closed loop artificial pancreas system. So like that is me. I'm able to do this. I've chosen to adjust my life and lifestyle, my profession to focus on this, to be able to manage it, because I knew that if I didn't do that, that my health would continue to deteriorate. Most people are not able to manage it the way that I do. But yet, that is the expectation that we put on patients. So anytime you introduce any new element into that workflow, it adds a significant burden on top of an existing significant burden. So what may seem like a small deal for a company who's creating a new tool or platform or product, or introducing multi-factor authentication, or they have trust tokens for connected to their patient portal that expires every 3 months, requiring a password reset that requires 3-factor authentication. Like all of that really is added to this existing burden that many people just can't manage, and they give up.
Yeah. Well, I mean, I'm just like struck by how many things there are. And what you described to me is like a full-time job. Like it's your full-time job to manage all of those things. And then in my head, I'm like, I forgot to take the 1 pill that I usually take in the morning this morning. And I'm like, and I couldn't even do the 1, let alone the 21 medications and all the other things. That's a fascinating way to describe the burden that patients are feeling. Are there any other, stories you have, from your life, or maybe from other people that you talk to, other patients that you talk with, that illustrate some of these challenges?
Oh, there are lots of challenges. I mean, I've done a lot of work over the years with patients with rare disease, and I have a niece and a nephew who have an ultra rare disease. The amount of medications, the amount of diagnostics, the devices they have to use for mobility and transportation, the workload that is, in the cases of rare diseases, it often hits, when people are children, the workload that's placed on their family and the burden that's placed on their family is substantial. And, it often leads to marital challenges amongst the parents. It impacts the lives of the other children. And it's not just the disease itself, which is horrible in many cases. It's the actual burden of caring for the disease and managing not just the day in, day out of that disease at home, but managing the medical care to support that disease.
Navigating the healthcare system.
Navigating the system, getting access to, through insurance companies, documenting all the stuff that you have to document. It's really just a remarkable amount of work, and it's mostly unpaid work. And, as we've seen efforts to do, medical homes, and there's been a lot of focus on care coordination, none of that in my experience really works. It just hasn't. I haven't seen, I've signed up for different disease management things that my insurance company sponsors, and frankly, it's just a waste of time. They waste more of my time than save it, and the resources they provide me aren't helpful at all. So it really falls on the individual or the caregiver for the individual.
The one that I feel like does make a difference is telehealth, to be able to see the doctor. And I saw someone describe it that that's really a health equity issue in a lot of ways for a lot of patients that can't get into the office, but they could hop on a telehealth visit. I think that's an interesting one for many patients. I don't know, has that been your experience?
Yes, telehealth has been, and the increase that we've seen in telehealth since the pandemic has been a tremendous, tremendous help for me for so many reasons. I mean, my endocrinologist, it's difficult actually to find an endocrinologist who's good at dealing with complex diabetes.
Sure.
Mine is about an hour away from me. Getting to him has always been a challenge. Traffic's horrible. It's difficult. I mean, it's just a lot. Being able to see him via telehealth has made it a lot less stressful and a lot more effective. And it makes it more possible for me to be able to see him more frequently and more seamlessly.
Yeah, that's awesome. But it goes back to your point. You have a wide variety of providers. And sadly, the burden is on you to make sure that they have the information they need across all these different providers. And that's where I found your story about information blocking so interesting. So, I teased that at the beginning. Tell me about your recent experience with information blocking, what happened, and what did you do about it?
So recently, over the past year, I've had some increasing issues with my vision. I have diabetic eye disease from many years with diabetes, but suddenly out of nowhere, it started getting worse and worse and created a bit of a mystery. And while the specific causes of it we seem to have solved, like the actual etiology and the development of it has been really challenging. So in recent months, my vision has gotten worse and worse, and my visual acuity has decreased substantially. I go in monthly to get eye injections in each of my eyes to take medications, but that wasn't working. So I saw my doctor a few months ago, and he said, this is now urgent. You need to consider doing a specific type of surgery. But there's a risk of actually, if you do that surgery, that will cause permanent damage in the central part of your vision. So it's critical that you think clearly about this. So when that happened, I used some of my contacts and managed to get into a retina specialist at one of the top retina centers in the country in pretty short order. I was very privileged to be able to do that. But what I really needed to do for that appointment to go well, and for the doctor to be able to make the right decisions about further imaging and treatment, is to be able to access the images that I had taken at my ophthalmologist every month for more than a year that showed the disease progression and showed the progression of the vision loss and what had been happening in the back of my eyes. When I attempted to do this, I was immediately sent to the medical records office, who promptly told me that I would need to write a check for the time and effort that they would put into getting the images. I need to send them the check via mail. This is a doctor that happily takes credit card for my co-payments.
Yeah. Wow.
So I would need to send them the check in the mail. It would have to clear, and after the check cleared, they would then have 30 days to get me the images that I needed. The medical records are located about an hour out away from me in a suburb of DC that I'd never been to. The doctor's office is about a 10-minute Uber ride. The images were actually stored at the doctor's office. I knew this. So the doctor would actually have to transport the images from their office to medical records, who would then download them and send them to me.
Wow.
So meanwhile, my appointment my urgent appointment with the new specialist was in 4 days.
Yeah. So 30 days doesn't work for you.
No, it doesn't work. And the thing about it that was really informative to me, this happened to be at a particularly stressful time. Not only was the vision issue stressful, there was a family. My mother was in final weeks of her life, and there was a lot going on with that.
Sure.
I'm on the Health IT Advisory Committee for HHS. We happened to have an in-person high-tech meeting while all of this is happening, and I'm sitting there completely overwhelmed with my vision issues, getting texts from my siblings about my mother. In other words, like living a life of anybody who's faced with an urgent health crisis.
Sure.
But I'm literally in the room with the people who wrote the rules around information blocking and information access, like Mickey Tripathi, the head of ASTP, Steve Posnack, all of the people who have been a part of this process and making it possible. And I'm telling them I can't get access to my images. I'm like, you should be able to get access to your images. But I mean, I was so overwhelmed that even though I knew the rules and I was with people who knew the rules, it was difficult for me to even think through what is the right question that I need to ask these experts. Later that evening, I happened to have a friend who was also in high tech who has been very involved with this. We were texting in the evening, and she reminded me about information blocking rules. And even though we've been talking about that all day, because of the stress and the challenges and the fear that I was experiencing, I couldn't think my way through it.
So you couldn't connect the dots. That's interesting.
I couldn't connect the dots. I'm like, I know the dots. These are things that I know and have talked about quite a bit.
Stress does interesting things, right?
It does. It makes it difficult to think through and problem solve in surprising ways. Once she prompted me with that, my friend, I went on ChatGPT, found the Code of Federal Regulations, the specific language related to information blocking, and then sent an email to the office manager and medical records office for this ophthalmologist who was preventing me from getting access to my images, and basically said, if you don't get this to me in a timely manner, because these are an electronic format, you're required to get it to me in a timely manner. If you don't do it, I will be filing an information blocking complaint with HHS and with ASTP. And that was the magic word.
And it worked.
It worked. But one thing I realized in the process is that the people in medical records and the office manager had never heard of information blocking. They had no idea what I was talking about. So it really brought home to me sort of the complexity of the issue, not only is it difficult for a patient who is in a time of stress to be able to, even somebody who really knows this stuff and is nerdy enough to be on high tech and, speaking and, on the board of Sequoia, even somebody like me in a time of stress can't think through or finds it difficult to think through, what do I need to ask? How do I need to solve this problem when I'm surrounded by the people who wrote the regulations? A, so that's part of it. B, relying on HIPAA and citing HIPAA, that to me was just infuriating on so many levels. Not only that the doctor chose to cite federal regulations as they understood it, but it was just insulting. It's like, come on, this is an urgent situation. You've told me it's urgent.
Yeah, you should
just
care
give
about
me
me as a human, regardless of regulation.
Exactly. And then C, the people who were in charge who were responsible for getting me what I needed had no knowledge of the federal regulations. So there's a lot you can do with policy, but it only gets you so far. The rest really depends upon providers and EHR companies and others within the system, and information management to take the responsibility to really make sure that patients can access their data in compliance with federal regulations. And more importantly, the patients can access their data in a way that allows them to protect and preserve and treat their health.
Yeah. I love that you used ChatGPT and that it worked when you did it, but it just should have never come to that. That's the astounding part of this story, right?
There's so many things about this that completely, I found astounding. Just from my personal difficulty in thinking through stuff that I know really well, as well as just, being surrounded by the people who literally wrote the rules, who are very supportive and were concerned for me and could see I was upset, to, the ophthalmologist office, these were not evil people. Yeah. They just didn't know. So there are so many different things about it that, suggest that we need to be working together and working in concert with a goal of making it easier for patients to be able to access what they need when they need it to manage their health and to work with their physicians to manage their health.
Absolutely. Well, we're here at the Sequoia Project annual meeting. You're on the board and do a lot of work with them. What is Sequoia Project doing to help patients dealing with burdens like the ones you're describing?
So I, in addition to being on the board, I'm leading and co-chairing the consumer engagement strategy work group. And our focus really has been on really digging into the need of the issue. We start from the point of all of the dysfunction, the data dysfunction with which patients are confronted, and with which, many of us live. And from that point, what does that mean? What are the barriers? What are the things we need to understand? And we spend a lot of time really digging into individual access and some of the barriers to individual access. But our focus now is really on beginning to develop tools and processes that will empower individuals at the point at which they are, somebody like where I have been recently, in a point of crisis, in a state of urgent need for medical data, medical information. How do we give them the magic words that I was able to get through my contacts? How do we give everybody those magic words to be able to say, this is what I need. These are your responsibilities as a provider to get to me, to get me data in a timely manner. How do we create tools and best practices for the industry to be able to adopt so that in a time of crisis that everybody will be able to get what they need to be able to take care of themselves?
Well, I love that. It's giving them the words to empower them, but also working with Sequoia Project and their partners so that the patient doesn't have to have the words, that they're taken care of automatically in the way that they should be taken care of.
Yeah, I mean, that's the goal. Ideally, it would just be, nobody really wants to focus on their health data. I don't really want to focus on my health data, to be completely honest. I used to have other hobbies that other people found far more interesting, or my friends and family found far more interesting to discuss than health data. But when you need it, you need it. And usually, I'm unusual in the sense that I've been dealing with different issues for quite some time. But oftentimes people are confronted with a dire need to access their data out of nowhere, where they're not really thinking about it. They're going on, they're living their life. Something happens for them or their family member, a loved one, and suddenly it's a crisis and you need to get access to your data. And you don't know HIPAA, you don't know information blocking rules, you don't know the head of the ASTP or the person who runs HIPAA at OCR. What do? You need to be able to go and get the information you need, not from a government website, but from the provider who has the data. So that's what we're really focused on, is giving providers what they need and developing tools that the providers will need to be able to give patients the tools and the data they need in a time of urgency. And then ultimately, we're going to be developing some recommendations for how the next administration, ASTP, can move forward and from a policy perspective and adopt policies to incentivize this kind of activity on behalf of, getting providers to do what they need to do to make life easier for patients.
Yeah. It's funny you say that. I have an issue I should be dealing with that I was in the emergency room a year ago.
Oh, no,
and the reason I haven't done that is because I don't want to go get the data. So it's literally what you just said. It's what's holding me back from doing it. And like you said, I'm hyper educated on everything that's possible and what's there. And even then I feel the burden. So, and it's such a small burden compared to what you described. And yet it still blocks me from getting the care I need. So I'd love to hear, what else would you say to encourage others, including myself, it seems like, and others that are working with patients? How can we better empower patients, or what other advice would you give to patients as well?
I would say start from a perspective of empathy, of what it's like to actually live in the midst of data dysfunction, and to be, to have a life, to have a job, to have a family, all of the responsibilities that everybody has to, the things the lives that all of us are trying to live. Starting from there, knowing how tired and exhausted that can make you, imagine having to manage 16 different physicians, 21 different medications, 11 different medical devices, labs, in addition to lifestyle, et cetera. And what that would mean in terms of from energy level, first of all, you're sick, otherwise you wouldn't have that stuff. You've got health issues. And then the amount of energy and time and headspace and brain space it requires to actually think through and problem solve at each point along the way for all of that stuff. And when one of those things goes off the rails, it can ruin your afternoon or distract you during a meeting. When 2 or 3 goes off or goes awry in one form or another, the prescription's delayed, a prior authorization is suddenly denied out of nowhere, the doctor goes on vacation and you don't have refills, it can really disrupt your health. Mm-hmm. And so as you're thinking through additional policies or processes or workflow, begin from the point at which you're empathizing with the person who's already living in a world of overwhelm. And what is it that you're going to add to their workload? Are you going to add to their workload, or are you working to decrease their workload? And I would like to encourage everybody and inspire and challenge everybody to really think about what can I do not to add to patient workflow, but to decrease the burden and to decrease the dysfunction. Ultimately, that's what we want. All of us don't want to think about this stuff. We don't want to be health information exchanges of one. We want the data to be where we need it, when we need it, in a format that works for us. We want our physicians to have the data so that we don't have to transport it to them. It's just there. We want the data when it gets there to be useful and to be meaningful, not just a whole list of ICD-10 codes with addresses from the past 25 years, like data that actually means something, that is useful, that can be readily recognized and utilized by the physician when they look at it. And we want to be aware of what it is that we're entitled to, and to really understand what it is that we have the rights and the ability to access, and what providers and organizations and companies are doing to facilitate that access.
Yeah. And I appreciate you sharing that about empathy. And I think, for me, just talking to you today has grown my empathy for what patients do. And I think everyone watching will benefit from hearing your story and growing their empathy and understanding for what patients go through. So I appreciate you taking time to talk with us. And thanks everyone for watching and listening. Let's all go out there and learn more about patients and how we can empower them. So thanks so much, Anna.
Thank you very much. It's been a pleasure.